The United States has one of the worst rates of maternal mortality of a developed country in the entire world.
For decades, the U.S. maternal mortality and morbidity rates have gotten worse for all mothers, but especially for Black women, whose health outcomes are further compounded by systemic and structural racism.
Women are dying during and up to 1 year after childbirth at alarming rates. Those numbers are about 2.5 to 3 times as high for Black women, and the COVID-19 pandemic is making things a lot worse. Communities of color are already disproportionately affected by the coronavirus, and maternal mortality is just one of the many things being impacted. Take Amber Isaac, for example. She was a young Black woman who died in late April, just days after tweeting about discrimination at a hospital in the Bronx. Her partner Bruce McIntyre told CQ Roll Call that her concerns about her health were not being heard, and she ended up dying in an emergency C-section.
Even when she would vocally express her concern, she was still not given fair treatment. She started being neglected.
This is just one of the many cases, and things are likely to get a lot worse. Many hospitals are banning family members and doulas from accompanying pregnant women into the delivery room due to COVID-19 concerns. And a lot of experts worry that this and an increased isolation from social distancing and self-quarantining is going to lead to increased rates of postpartum depression and anxiety, which are already underdiagnosed among women who've just delivered. There's also an increase in the demand for birthing options outside of hospitals because women are afraid to go in and possibly be exposed to the virus. Birthing centers and at-home births are not always covered under all insurance plans, and they're especially popular in the Black community. And so experts worry that these are some of the concerns that are going to be especially hard felt by African American women, and that different concerns with maternal mortality could get worse. Congress could take action soon. Lawmakers like Kamala Harris of California and Cory Booker of New Jersey in the Senate and Alma Adams and Lauren Underwood in the House say this is a big priority for them, and there's already some policies in the pipeline. Some of it is to extend Medicaid coverage for up to a year after a baby is born so that women have continuous health coverage and are less likely to die from a number of complications after the pregnancy. The question is, how long will it take for some of these policy measures to be taken up? Will they be rolled into one of these COVID-19 spending packages, or will they possibly be tabled indefinitely?